Let's talk about this, the subvariants BA4, BA5. How critical a situation are we going into at the moment?
Well, we've certainly seen a rise in this new variant of Omicron. So this is still the COVID-19 virus. The SARS-CoV-2 virus is just a different, slight differences in the way that virus looks and how our immune system looks at it. So we do know that this new variant has caused waves in other countries and is now becoming the dominant variant here in Australia. We have no suggestion at the moment that it causes more severe disease, but it does escape our immune system, whether that's due to previous infection or vaccination. The good news is that the vaccination we have available, particularly if you've had a third dose or for now an expanded group of people a fourth dose, does give protection against severe disease, and I would very much encourage anyone watching to check those new availabilities, and if you are eligible for a fourth or a third dose, absolutely go and get it and get that organised this week. We have seen a reluctance from some people to get that third dose, and also with the fourth dose for some people, and so now's the time to reconsider that.
Yeah.
We do expect that these new variants will cause a rise in cases and probably hospitalisations in the coming weeks, so it's a very important message.
Well, we're already talking about some hospitals in some states putting off elective surgery again because of the demand. Do you anticipate that happening?
Yes, and that's something that happens every winter with influenza, and we have seen influenza again this winter as predicted, and for the first time in 3 years. And so there has been quite a lot of influenza out. There's also other cold and flu viruses or cold viruses, particularly RSV, which affects children in particular, has been circulating this year for the first time in a couple of years. And so all of that together has caused issues in our hospitals, and so that's a pretty standard thing to be done at this time of year during the winter season. And with this increase now in the COVID, the new variant of COVID, that's exacerbated that problem. Excuse me.
Yes, it gets all of us, the bit of the cough, especially at this time of year. What difference does it make when the states make that decision to follow what the health officials have said and reduce that infection time from 12 weeks, or the reinfection period, the immunity period, from 12 weeks to 4? Because there are so many people I've had say to me, and I've said it myself, you know, I only had COVID a couple of months ago, I'm okay.
Yeah, so this is, it's based, as always, on the Australian Health Protection Principal Committee's deliberations, and that group based very much on the evidence. And so it's yet another curveball that's been given to us by this virus. The new BA4, BA5 variants are more infectious. There is now strong evidence that you can get reinfected earlier than what we had previously seen to be the case, and so it's important that anyone who develops symptoms again 28 or more days after they have had a previous COVID-19 infection to get tested and to take the appropriate arrangements in terms of isolation. And most importantly, and this is a really key point, if you are in that situation, you might be eligible now for the treatments, the oral treatments. And so have that discussion now with your GP. Have that this week. If you are over 70, if you're over 50 with 2 risk factors, and there's a whole list of those on our website, and you can get that information from your GP. Because you may be eligible for those new treatments, which will definitely decrease your risk of severe disease and even death. And so that's a really important message to viewers today.
Paul Kelly, viewers are seeing death rates still at high levels, hospitalisations. We've got a severe outbreak on board another cruise ship that's heading between Brisbane and Sydney. And yet the health officials reluctant to be saying, you know, we need to bring back mandates on masks. We need to add some urgency to this, I guess. There seems to be a disconnect between the messaging that we're getting and the lived experience by people.
So I would dispute that we're not giving strong advice and that urgency is not there. We've certainly, over the last week, as you mentioned at the start of this, the AHPPC did give strong advice about what can and should be done. We've had that increase in eligibility for fourth dose vaccines and a really strong increase in the messaging about third doses of vaccine. We've had that increase in the eligibility criteria for oral treatment. So all of those things and a strong messaging about the using of masks again in indoor settings that has come through. In terms of mandates and so forth, that's really a matter for governments to consider and take that advice. But that's something that we're not advising ourselves at the moment. That's for governments to consider.
All right, Paul Kelly, thank you very much for coming on the program this morning.